Chirurgia stereotactică este folosită și în neurochirurgie. Pe acest subiect am discutat și cu domnul dr. Akin Sabanci despre DBS, Deep Brain Stimulation, adică stimularea cerebrală profundă în boala Parkinson.
Parkinson disease is a neurodegenerative progressive disease. It has some major symptoms like tremor, which is shaking hand, and it is mostly while the patient is not doing something. It is while the patient was watching TV or doing something without any action. And other thing is bradykinesia. Bradykinesia is slow motion, of the movements. The other thing is stiffness. Rigidity. The more correct thing is rigidity. Rigidity in the wrist, elbows, and all the extremity joints. And the other major symptom is postural instability, like the patient will fall down in the upcoming 1 or 2 steps. So these are the major signals of Parkinson. I'm talking about Parkinson because Parkinson is the most common functional neurosurgical disease. But also we deal with dystonia. Dystonia is, some jerky movements, like these kind of jerks. And also we deal with essential tremor. Essential tremor is when you, for instance, want to take this water and want to drink it. It is while the patient is doing an action, he is unable to drink the water. So these are the 3 diseases that functional neurosurgery deal with. But also there are some small population of diseases like Tourette syndrome, and nowadays there are new indications like psychosurgery, like obsessive compulsive disease patients may benefit from these kind of surgeries. And also psychosurgery it was in the past, it was tried before, but nowadays it's getting more common, being more used.
Can you describe a little bit treatment, how it's made?
First, we have a neurology team with us. The neurology team evaluates the patient. Also, we see the patient together, and we make a UPDRS test. This UPDRS test is something like you give some points from 0 to 200 that you ask the patient, are you able to button your t-shirt, your shirt, and can you be able to do your own meal, something like this. And you give a score to the patient, and then the patient takes the tablet, which is the treatment of Parkinson's disease, which is Madopar or dopamine. After he takes the pill, after 1 hour later, we take again another UPDRS test, and we see the improvement. If the score is less than 33%, the previous one, we say that this patient got benefit from the Madopar, and it's an indication for DBS surgery. And we look to the other general anesthesia workflow, and if everything is all right, we take the patient to the surgery. It is something like we take the MRI 1 day before the surgery. It must be a 3 Tesla MRI, and with this 3 Tesla MRI, we put the patient's head to a stereotaxic frame. We fix the frame with some needles to the skull, and this is all under local anesthesia. We put some local anesthesia. We take the patient to the CT suite, and we take the CT in that day, in the morning of the surgery, and we fuse the 1 day before MRI and the CT. And we take the coordinates because we are able to see our target in the MRI, but we can do the surgery with the CT frame, the leg cell frame, and then we fuse them. We make a fusion of them, and we take the patient to the OR, operation room. In the operation room, the patient is again under local anesthesia, and it takes 2 hours for us to make the surgery. We make 2 small incisions in the frontal, which is the front part of the skull, and we make 2 burr holes, 1 centimeter, 1 and 2 centimeter radius, burr holes, and we sent 2 cables there. We call these cables as electrodes. And for instance, if the patient has tremor in the right side, first we shoot from the left side. We give some test electricity and observe. If the tremor is gone, we are sure that we are in the correct target. And we take back the test electrodes and we send the original electrodes there.
Okay.
This is all under local anesthesia. We do the same thing for the opposite side, and then the operation under local anesthesia is finished. We take out the frame, and something like half an hour time, we put the original battery under general anesthesia, and we connect these cables with this, we call it IPG. This is the actual battery actually.
Yes.
And we connect them. It's totally like 3 to 4 hour operation. And basically the workflow of the operation is like this.
Când medicația nu mai poate controla eficient tremurul, rigiditatea sau blocajele motorii, DBS poate fi o soluție salvatoare. Simptomele motorii se reduc, iar funcționalitatea se îmbunătățește semnificativ fără medicamente. Procedura presupune implantarea unor electrozi extrem de fini în anumite zone ale creierului, care apoi sunt stimulați electric printr-un dispozitiv similar unui pacemaker cardiac.
And the patient stays with this
For whole hour time. Yes, this question is good because nowadays we are using rechargeable batteries. Rechargeable means every 2 times in every week the patient charges its battery. These are the rechargeable ones. Like you charge your iPhone, but they are wireless.
Okay.
And in the past we were using no rechargeable ones. They are something like 5 to 6 years period. After 5 to 6 years you have to change the battery. But you don't have to recharge it every 3 days in her lifetime.
The cables are seen on the...
When the patient touches them,
Yeah.
he can feel it, but our patients are able to swim, they can go to bed, they can go to every kind of spa or pools, they can do whatever they want. They are touchable, they can feel it, they are just under skin.
Stimulatorul și cablurile sunt plasate sub piele, iar pacientul își recapătă autonomia, poate nota sau chiar poate merge la saună. Chiar și unii chirurgi afectați de Parkinson au apelat la această tehnologie și și-au reluat activitatea.
Is there needed some changes over few years or something like that?
These are
this kind of situation to change something to...
Yes. In the future, they are talking like not using these cables coming from here to the pectoralis major. This is positioned in above the pectoralis fascia. The technology says that we will put a small thing here. Yeah. They are working on it. Even if they say we will not put any cables, we will be doing the stimulus from other side with like magnetic kind of some technologies, but this will take time, I think.
And the function is 100% or
No.
70 or
yes.
50 or...
The actual thing is we cannot take the patient to while he was 18 years of age.
Of course. No one.
Yes. The thing is the patient uses less and less dosage of drugs.
Yes.
And these drugs has very high risk of side effects, like dyskinesias. Dyskinesias are jerky, like dystonia, jerky movements. So when the patient is able to take less dose of drugs, he will benefit less dyskinesias. Also, the other thing, some patients can stay without any any medication. This is the gold time. But this is the 100% time. But we generally say that you will benefit from your motor symptoms like 80%.
Okay.
So this helps to these patients a lot. And generally this is a mean time, but every idiopathic Parkinson's disease patients has something like 15 to 20 years after the diagnosis, they will get worse about these all motor symptoms. But during this 15 to 20 years time, he will have a high quality of life. Otherwise, they will have low quality life from the beginning of their treatment. So this is not something like a miracle. This is not that all these complications, all these symptoms like tremor, rigidity, bradykinesia, postural instability, they will go away. We cannot say it, but 80% of them will go away, and the patient quality of life will increase much and much more.
Is it possible if they do actively recovery, let's say sports medicine, or
We generally motivate our patients after the operation to go for the physical therapy and rehabilitation. Yes, they can do them. We have different kind of patients, like we have an orthopedist who was operated with this 20 years ago, and he continued to do these operations. We have a gynecologist from Macedonia. He made this treatment and now he's doing his work. There are also doctors and surgeons who have been operated for this surgery.
they work?
Yes, they work. They
great.
work. Yeah.
Domnul doctor mi-a mai vorbit și despre intervențiile spectaculoase asupra unor tumori din interiorul capului pe cale nazală. Spre exemplu, pentru tratarea tumorilor hipofizei, ce uneori pot fi și de dimensiunea unui ou, medicul poate intra cu un endoscop prin nas, deschide sinusul sfenoid, îndepărtează peretele anterior, sparge tumora, o fragmentează și apoi o extrage.
Dacă vrei să fii contactat de un consultant, scrie Aci Badem în comentarii.